It's been 4 years since the CDC openly declared racism a public health threat.
It was a call to action to reduce disparities made clear by a global pandemic and disturbing statistics. Black people were more likely to die from COVID than other races. They have higher rates of cancer and are more likely to face barriers to receiving health care.
This Black History Month, WRAL health reporter Grace Hayba looks at how activism and health advocacy are not a new combination, but one the Black community has been practicing for decades.
Change doesn't happen overnight, and in healthcare, it can take generations.
Free at last, thank God Almighty!
Something leaders like Dr. King knew well.
He felt that the injustices we see, or even saw then, like in our healthcare system, is the most inhumane of all.
For Karita Giddings with the North Carolina Black Alliance,
it has been an uphill battle.
The fight for equitable care continues daily. Working alongside Black politicians and local organizations, the Alliance played an active role in the push to expand Medicaid in December 2023.
Before that, what did health equity look like in North Carolina? There were about 600,000 people, predominantly Black, brown communities that did not have access to health care.
It was a testament to the power of perseverance and a win the Alliance says was a long-awaited result of decades of relentless advocacy. In 1899, W.E.B. Du Bois published the first sociological case study of an American Black community and revealed significant disparities in mortality rates and access to care. It would take another 122 years and an unprecedented global pandemic for the CDC to openly declare racism a serious public health threat in 2021.
It was undeniable how bad it was. I mean, we were quarantined, we were social distancing at home. And so when you took away all of the noise, right, of the day-to-day, and you saw that at disproportionate rates, Black people were dying from COVID-19 in comparison to other groups, it really put a spotlight on how bad the inequities are with access to care, but also just trust and bias in our healthcare system.
Giddings and her team, some of the many faces continuing to move the needle, pushing for things like greater diversity among those in white coats.
The mirror effect, right? People trust those who look like them a little bit more.
Though progress to forge a more just healthcare system may at times feel slow-moving, modern-day efforts rooted in the work of those who came before us prove change is possible. Grace Hayba, WRAL News.
So in 2021, the CDC launched a new web portal named Racism and Health as part of a, quote, ongoing commitment to serve as a catalyst for public and scientific discourse and to be accountable for our progress. This same site was recently removed as part of President Trump's executive order.